It's a great question, not a very easy one. Just like with very young children, children with developmental disabilities such as intellectual disability or other sensory disabilities who may have verbal and expressive difficulties may not always be able to report abuse. So how then can we tell? So one way is, of course, for caregivers to be very alert to especially when they are assisting such children with daily activities, personal care, to look for any signs of injury in older adolescent girls, to be acutely aware and alert to menstrual cycles and to know that if a cycle has been missed, that there is the possibility that this girl could have been abused. Other emotional and behavioral indicators, while these children may not always be able to tell in the conventional way, to look at emotional and behavioral changes, to look at restlessness, crankiness, sleep and appetite changes, all of which are indicative that these children are going through something else, that something else is happening in their lives. While that may not be abuse or rather sexual abuse, it could be other forms of abuse, to also suspect that this child could be either physically abused, sexually abused. There is some discomfort that a child is experiencing due to which she or he may be acting out and may be reflecting these changes.
So there are medical indicators, which are hard indicators that one needs to be alert to, and there are behavioral indicators. Now, particularly where there are high functioning and verbal children with disability, the chances that they would report or indicate are very much there, and one needs to be conscious of this possibility. So between medical indicators, behavioral indicators, and changes are the changes that you see, and a verbal report, where I said as some of the kids with high verbal ability or high functioning intellectual disability may still be able to report.